Hello everyone, welcome to my channel. Today's video is about otalgia. Let's learn in detail about otalgia. Otalgia is basically disorder of the external ear which might be due to infectious or non-infectious causes. The main characteristic of otalgia is earache, that is pain or ache in the ear. The external part of the ear is called as pinna, which is the outer visible part of the ear. Through the pinna, the sound waves is channelized towards the middle ear and then inner ear. The space or cavity through which sound wave travels is called as auditory meatus. It is also called as external auditory canal or external auditory meatus. This is about otalgia, where there is perception of ache in the outer part of the ear. There is etiology with types. So otalgia can be divided into primary and referred otalgia. Primary are due to acute causes, whereas referred otalgia occurred due to risk factors. So primary otalgia etiology can be, first of all, laceration and bite. This bite can be animal bite or insect bite. Then it can be impacted wax. Impacted wax means when there is more than normal level of wax deposition in the ear canal, that is impacted wax, that disturbs the transfer of sound waves towards the middle ear and inner ear. Next is hematoma. In hematoma, there is bleeding. Because of bleeding, the sound waves, the pathway of sound waves have been distracted. Next is foreign body. Presence of solid or liquid foreign body can disturb in passage of sound. Otitis externa. Otitis externa can be any infection or disorder of the external part of the ear. Keratitis obturans can be infectious condition, which is in which the discharge is leaked towards outer part. Perichondritis, infection and inflammation of pinna. Herpes zoster infection, also neoplasm. Because of growth of neoplasm, the sound waves might have difficulty to travel, which might result in otalgia. Also, acute otitis media, this is middle ear infection. Traumatic perforation, because of any trauma or injury, if there is perforation to the tissue. Mastoiditis, infection and inflammation of mastoid gland. Meniere's disease, disease characterized by vertigo. Middle ear disease characterized by vertigo, Meniere's disease. Also cholesteatoma. Cholesteatoma is deposition of fatty particles, small little fatty particles in the ear, which disturbs the hearing. In referred otalgia, we divide the referred otalgia on the basis of nerve. First of all, there is trigeminal nerve. Through trigeminal nerve, there is teeth infection, which can be the first etiology. Also in the oral cavity, impacted DNS, deviated nasal septum, sinusitis, nasopharynx infection, and trigeminal neuralgia. Teeth infection can be spread towards the ear. Also in the oral cavity, also can be spread, transmitted to the nearby organs. When there is impacted DNS, through the nasopharynx and eustachian tube, the same bacteria or pathogen can travel till the middle ear, which can cause otalgia. Ear, nose, and sinuses are closely related to each other. So infection and inflammation in one part might create effect in another part. During nasopharynx infection, as nasopharynx and middle ear tympanic membrane is connected through eustachian tube, so nasopharynx infection might spread towards the middle ear or eustachian tube. Also, trigeminal neuralgia. In disease related to nerve disorders, there is disturbance in perception of hearing. Next nerve is glossopharyngeal nerve. Our previous nerve was trigeminal nerve. This is glossopharyngeal nerve. Tonsillitis can be etiology. Peritonsillar abscess can be a etiology. Oropharynx infection. Glossopharyngeal neuralgia. This is disturbance in transmission of nerve between brain and pharynx, glossopharyngeal part. Eagles syndrome, stylalgia. In stylalgia also, there might be otalgia. No matter if there is infection in pharynx, middle ear, larynx, but because there is connection with the ear, there might be symptoms in the ear as well. 5. Facial nerve. Now next nerve is facial nerve. Orpus zoster infection can be the first infection. And then schwannoma. In schwannoma also, or vestibular schwannoma, vestibule is the inner ear part. In vestibular schwannoma, there is abnormality in the base part, vestibule part. And because of that disturbance, there might be some kind of discharge and some kind of, even if not discharge, the symptoms which are caused due to this vestibular schwannoma reaches till the outer ear. So there is pain sensation or pain perception, which is called as otalgia. Next is vagus nerve. Till now, we have discussed trigeminal nerve, glossopharyngeal nerve, facial nerve, and now this is vagus nerve. In vagus nerve, if it is through vagus nerve, there can be larynx neoplasm and infection, foreign body in larynx, orpus zoster, cervical spondylolysis. So these can be the etiology which can lead to otalgia. Risk factors for otalgia can be insertion of unclean and sharp articles into the ear. So if there is insertion of unclean sharp articles without any knowledge, without any awareness, that can be a risk factor. Installation of contaminated solution can be another risk factor. Swimming in polluted water, because polluted water contains chemicals, liquefied chemicals, or pathogens that might be harmful for ear. Recent upper respiratory tract infection. Any infection which is associated with respiratory tract, especially upper respiratory tract, can be transmitted to the middle ear because there is a connection through eustachian tube. And eustachian tube allergies can be another risk factor. When there is allergy, there is anaphylactic reaction, and because of that anaphylactic reaction, the surrounding organs may also suffer. Pathophysiology can be, first of all, due to trauma or infection in the outer or middle part of the ear, there is release of inflammatory mediators. These inflammatory mediators try to protect your body. Whenever there is any pathogen, any external antigen trying to attack your body, inflammatory mediators try to protect your body. It is a defense mechanism of the body. After that, chemotaxis of leukocytes and tissue edema occur that causes pain and redness, because of which otalgia occurs. Clinical features can be earache or pain, perceptions of articulated sound. Articulated sound is manipulated or modified sound. So, a sound which is normal for a healthy person might be articulated for a person suffering from otalgia. Jaw stiffness, dizziness, nausea, and hearing loss can be other clinical features. Main clinical feature is earache or pain itself. These all are associated clinical features, others. There can be medical, surgical management. Medical management, first of all, can be ear irrigation. Normal saline can be used to irrigate the ear if we want to remove any foreign body or excess earwax. Along with that, if there is infection, amoxicillin can be given. Doses can be 80 to 90 mg per kg per day. Also, because the pain is the main characteristic here, we can provide analgesic. Analgesic can be provided on basis of WHO ladder. Video about WHO ladder is in medical surgical pain topic. So, according to the severity of the pain, condition of the patient, age of the patient, analgesics can be given according to WHO ladder. Surgical management can be myringoplasty, repairing of internal ear cells, tympanoplasty, repairing of middle ear cells, ossiculoplasty, again repairing of ossicles, internal ear, myringotomy, removal of all the tissues that are creating disturbance for hearing, mastoidectomy, removal of mastoid cells that are creating disturbance for the muscle movements that are required for hearing. After ear surgery, these are the precautions that should be followed. First of all, the patient must lie with affected ear for 6 to 8 hours after surgery, because if there is any discharge, any drainage, that can come out easily. Then there is the position of lying towards the affected ear. The client should blow the nose gently one side at a time to release secretions, because blowing the nose forcefully might create pressure in the part where there is bleeding or where there is foreign body. So blowing the nose gently will help us to release the secretion, also to create as much as possible less pressure to the site. After 1 week of surgery, client should sneeze or cough with mouth open for 1 week after the surgery. This means that till 1 week, patient should sneeze or cough with open mouth so that any secretion can be released at that time. Physical activity, heavy lifting should be avoided, because physical activity and heavy lifting provides pressure towards the affected part. The cotton ball which is used in the ear should be changed daily. If patient desires to change 2 or 3 times a day, still okay, but it should at least be changed once a day. Ear should be kept dry for at least 4 weeks. Installation of ear, any kind of liquid by the patient himself or herself should not be allowed. So ear should be kept dry for at least 4 weeks. Patient should not shampoo for 1 week. Washing the ear with shampoo might create some disturbance in the surgical part, because if the shampoo reaches towards the ear and by mistake if it reaches towards the surgical part, then shampoo, the nature of shampoo might create irritation to the part where the procedure was done. In case there is bleeding from the ear, the patient should contact the hospital immediately. Thank you so much. Next topic will be discussed in next video.